Thank you, Peter. Can everyone hear me all right? Is the sound okay?
Yes.
Yeah.
It's good. Good. It's a nice intimate group. It would be a nice discussion. I also have a shortened version of my presentation on YouTube. So if you have colleagues or students that want to get an idea what I talk about, it's kind of like a visual abstract. You know, people's attention spans are very, very short. They're not going to go to YouTube. And I know a lot of people record their lectures. It's good for students. But for most people, you try to keep it very, very short. Just give them the meat, the idea of what you want to say. So that's on YouTube. Um, my name is Dr. Robert Gordon. I'm a board certified psychoanalyst and clinical psychologist, a researcher, and a forensic psychologist. And there's different points of view. Give me a really good lenses in terms of looking at things from, in terms of automatic unconscious traits to looking at societal influences and when it intersects with the law. Today, I have to say I'm in a very good mood because psychohistory was made yesterday in a courtroom in New York City where Trump, who by just any intelligent expert in psychological diagnosis is a psychopath, a term I prefer to sociopath. I make that distinction in court all the time. Sociopath is someone who, but for society, would have not been engaged in antisocial activities. Their brain is pretty normal. A psychopath, we could actually see with functional MRIs that the frontal lobe, it doesn't metabolize many sugars. It's pretty much a biological condition, although they're not insane. They know what they're doing. But he, like many world leaders, ascend to power because they want omnipotent control over other people. And they have sadistic and sadistic and psychopathic traits, at least. He's a dangerous character. And what was really unusual is that he was convicted of all 34 counts. And America is divided now, so our prognosticators didn't expect this. But the jurors did weigh evidence, which just shows that as crazy as democracy is, swinging wildly from a Barack Obama to a Donald Trump to a Biden to a likely Trump presidency again. He's ahead in the polls. We see that in the long run, democracy works. So I'm in a good mood. Yes. Did somebody? Okay, let me get to my presentation, and then if you can hold your questions at the end. The theoretical basis for my research, I'm an empirical researcher, is the Psychodynamic Diagnostic Manual for people familiar with psychoanalytic theory. This is one of the most important things that happened to the whole field of psychoanalysis in the last 100 years, because a science needs a good definition of its independent variables and a way to measure those independent variables. Otherwise, it's an armchair philosophy. And the problem with psychoanalysis is that, opposed to what Freud wanted, a lot of people saw psychoanalysis as a qualitative, epistemological endeavor versus an empirical science. And probably much from the invention of the functional MRI and do empirical research, both field and laboratory, psychoanalysis has really grown as a science, is now certainly recognized by the American Psychological Association, a very anal organization, as a science now. And the Psychodynamic Diagnostic Manual, second edition, and we're working on a third edition, is research-based, nosology, where unlike the Diagnostic and Statistical Manual of the American Psychiatric Association or the International Classification of Diseases from the World Health Organization, the Psychodynamic Diagnostic Manual is not just a collection of observable symptoms. It's about the whole person, the full range of personhood from healthy. We define what healthy is. It's not just about disorders. And we look at healthy, neurotic level, borderline level, and psychotic level disturbances, as well as personality syndromes. And later I'll talk about the basis of this study is mental functioning. A colleague and friend of mine, Karen Messina, just published a book, A Psychoanalytic Study of Political Leadership in the United States and Russia, in which I have a chapter. And in that chapter, I didn't feel as constricted as I have in my peer-refereed journal article on this topic, which is very much more research-oriented. I'm able to get into more the psychohistory and the problem that I'm hoping to solve in terms of educating the public about the mental functioning of leaders. And lastly, I just published a book on things I've learned as a scientist, therapist, and forensic psychologist, in which I get into this study as well. Now, I don't know, could you see the whole screen? My screen is kind of like blocked by a screen sharing message and stuff, but the Psychodynamic Diagnostic Manual is about 1,000 pages. We try to shorten it, but it's impossible. When you talk about developmentally disorders of infants, children, adolescents, adults, and elderly, we divide it in developmentally, and all the various syndromes that are in there. So Bob Bornstein and I we're both experts in psychological assessment, particularly personality assessment, got together and said, we have to find a way to code the diagnostic picture of the PDM, the Psychodynamic Diagnostic Manual. If we don't do that, people won't use it. And it's very, very hard because psychodynamic theory is a complex dynamic theory. It's not static like behaviorism. And that means that we can't have a periodic table. It's not static. And the best I came up with is something more biological, nesting, just like we have life forms and non-life forms, animals and vegetation and vertebrates and invertebrates. We start out with personality organization. Looking at, and this is mainly, we believe, genetic, made worse by childhood traumas, of course, healthy level, neurotic level, borderline level, and psychotic level. And then we have the personality patterns. They only become personality disorders if they're at the severe neurotic, borderline, or psychotic level. I mean, you could be, we all have temperaments. We're born with temperaments. As Theodore Milan stated in his a book on evolutionary development of personality styles, is that it served evolution as a group, as a tribe, to have different styles of personality. In the modern age, they become dysfunctional, but psychopaths were our great warriors. Narcissists were our great leaders throughout evolution. The obsessive compulsives, like me, who do research, we came up with the arrowhead, you know, and the spear. So there are functions. These serve functions. And it's important to look at them not in terms of pregnant or not pregnant, in terms of a binary way, but in terms of personality organization by degree. So a high-functioning obsessive compulsive, which I like to see myself as, could actually publish research and get things done. If I was at the borderline level, I would imagine myself as a researcher, but blame everybody else for not getting published. And if I was at a borderline, if I was at OCD at the psychotic level, I already got my Nobel Prize for my research in my mind. So it's dimensional. Now, the next level is mental functioning. And Bob Bornstein did a lot of work on this. This is old ego psychology being resurrected. I always liked ego psychology because ego psychology wasn't so much stuck on the idea of neurotic or not, narcissistic or not, but what is the quality of their relationships? What is the quality of the reality testing? What is the quality for resiliency? What level of defense do they have? And being someone who got his PhD in the 70s and working first in mental hospitals, that was my job. Not just to simply come up with a diagnosis, but to understand a person's strengths and weaknesses. And you'll see later on, I purposely focused this research on mental functioning. Why? Two reasons. One is we have a lot of research on personality organization to validate the scale. We have a lot of research on personality patterns to research the scale. There was very little research on mental functioning. So part of the reason for doing this research is a validation study of the mental functioning part of the psychodiagnostic chart. The second reason is it's very controversial in America. We had a professor at Yale University fired because she edited a book, The Dangerous Case of Donald Trump. It was published right in the beginning of his first administration. She was fired from a major Ivy League university. Of course, they made an excuse to fire her, but that was really the reason. They get a lot of funding from Republicans. And I didn't want to get caught in the idea of saying he is a con artist, he is a psychopath, he's dangerous. There's a lot of evidence to support that, as Bandy Lee's edited book spoke about. But what I wanted to focus on is the idea of an assessment of mental functioning. Because believe it or not, and they've done research on this, Trump supporters, if you tell them that Trump is a psychopath, they will say, good, we need a kick-ass person up there to clean house. I want a mafioso on my side to do what I want. So actually, he doesn't lose any votes. We found that out. He knew this when he was running for president the first time. He said, I could shoot somebody on Fifth Avenue and not lose any votes. And he was correct. So there's several reasons why I avoided the simple assessment of diagnosis, but get into mental functioning, because both sides are claiming that the candidates Biden and Trump are lacking in mental functioning. Now, looking at this overall concept, a psychodynamic concept is that symptoms are the emergence, falls out of these things. This makes psychodynamic theory different from what's in the DSM, the ICD, behaviorism, descriptive psychiatry. Makes a difference. Where this is an emergence from looking at personality organization, personality patterns, strengths and weaknesses within personality, and of course, looking at cultural factors and contextual factors, like going through a death, going through a divorce, custody fights, things like that. So this really is essentially a clinical utility study. How useful is the scale? Now, this is the first page. This is free, by the way. Bob Bornstein and I decided that not to publish this for a profit. You could search this online, the Psychodiagnostic Chart, and download it. And it's very easy to teach. Everything is on simple scales. We made it so that the average clinician can do it. I did a study showing that CBT clinicians, cognitive behavior therapist clinicians, like this scale, because if they're doing cognitive behavior therapy and they're not getting results, they want to be able to blame it's not the CBT, but it's the person's borderline. So, I'm providing them with what's known as rationalizations. So in their survey, they said they like this psychodiagnostic chart. And when I teach this, I say, don't worry, you don't have to be psychoanalytic. You can still hate psychoanalysis and use this scale. So they happily use this scale. And this shows you how on the scale, how to come up with, very simply, the level of personality organization. This is very early on what Freud was talking about when he differentiated early on neurosis and psychosis. And Freud, as opposed to Jung, who worked with psychotics, pretty much said psychoanalysis is good for the neurotic level. So Freud understood that it's a conflict trauma treatment. However, his theory is applicable to everyone, and as we know, psychohistory. And he acknowledged that. He said, I have a great theory. The treatment itself works best with neurotics. And you know what? Over 100 years later, empirical research supports what Freud said. Actually, empirical research, there's several books written on this, supports about 80% of what Freud hypothesized. But these 4 factors I found from a stepwise regression equation, in other words, mathematically doing empirical research. And it perfectly fits what Otto Kernberg stated in 1980 on his book On the Borderline, when he started talking about levels of personality organization. So it supports also Otto Kernberg's theory when he's introducing the idea of the borderline. So the 4 factors are how stable a person's sense of identity, their quality of their object relations, could they have mutually satisfying intimacies, the level of defenses, which I started doing research on this in grad school. It's fascinating to me. And I think if you need one variable, this variable accounts for most of the variance, psychotic level, borderline level, neurotic level, healthy level. I often teach that defensiveness is very important in life. And a lot of people don't even know about the healthy level. When people go home on a holiday to visit their parents and they come back and they're having an analytic session and they're just really injured by the empathic failures of the parents, I'm thinking, what did you anticipate? You have a child's notion of a someday delusion that your parents will recognize you and give you what you want. And this is a very common psychoanalytic interpretation. So I introduced the idea in this scale of like self-assertion, sublimation, suppression. We all have thoughts of what we would like to say. The healthy person uses wisdom to just simply not say it. Altruism, humor, to teach that there are healthy coping mechanisms. We do this regularly in psychoanalytic sessions. And the quality of reality testing. So these 4 variables account for almost 90% of the variance if we want to look at personality organization. So I wanted to simplify it. One of the goals of this chart is that a CBT therapist, a non-analytically trained therapist, could pick this chart up with little or no training and make an assessment of their patient, their client. And then later on, if they get more information from psychological testing, more interview data, collateral interviews, or whatever, could change this as they go along in time. But I wanted it with high clinical utility. Bob Bornstein, by the way, is one of the leading experts in the Rorschach, an instrument that I love. I think it's very valuable. It's come a long way in terms of empirical validation, but it's very hard. It takes years to get good at the Rorschach. So one of our goals was to make this easy and clinically useful with empirical validation. This is the next page. This is actually a page from the Psychodiagnostic Chart. And you can see, unlike the ICD or the DSM, we're following research that shows that it goes according to the factor of internalization versus externalization. That these personality syndromes or types start with internalizing. Depressives internalize. They blame themselves. They turn it inward. The psychopath, the sadistic personality, turn it outward. So this is arranged in terms of internalizing syndromes to externalizing syndromes. Do you see that? And you rate it on a scale from 1 to 5. 5 is high functioning, 1 is at the psychotic level. And you can see with the psychopath, we broke it to the passive parasitic con artist type and the aggressive type. If you want to see a good example to give to your students, the Coen brothers did a movie called Fargo. And Buscemi, the actor, plays the con artist type, and the other actor plays the aggressive type. But we subdivide them. Most politicians would be the con artist type. Hitler would be the aggressive, sadistic, paranoid type. Now, this is the area that I worked on validating, but we had enough research on everything else. And this has to do with mental functions. This is another part of diagnosis. Remember, we're looking at overarching big categories first: healthy, neurotic, borderline, psychotic. Once we get to that level, then the next one is that we're all born with personality styles. What style is this person? More internalizing, externalizing, more of an anxious or depressive, more of a borderline, dramatic, histrionic type. Then we look at what are the various strengths and weaknesses within the personality. And we divide it into 4 categories: the cognitive affective processes. And again, this really comes out of what was known as ego psychology in psychoanalytic theory. The first one is akin to intelligence. And as you know, whenever you do a psychological battery, you measure intelligence, reasoning, capacity for regulation, attention, and learning. The next function is capacity for affective range communication and understanding. This has to do with experiencing and communicating in a constructive way the full range of human emotions. If you get a patient that's very uncomfortable with expressing love, that's expressing anger, that could be a neurotic issue. If you're unfortunate enough to have a patient that's psychopathic, they have a too much problem with aggression and expressing it. So it has to do with the ability to recognize and understand their affects, having to do with affect processing. Capacity for mentalization. Mentalization is a Peter Fonagy term, a developmental psychoanalyst, and reflective functioning. And reflective functioning, Peter Fonagy argues, goes from the earliest bonding, the response of the mothering figure to the infant, that the mother is in sync with the infant, and the infant slowly, through its childhood, well into early adulthood, is developing the capacity. This is different than insight. This is different than empathy. The ability to know the mind of oneself and others. That's different than empathy. Very, very important. Fonagy argues that, particularly working with borderlines who have difficulty with mentalization, that this should be the focus. I was trained classically, and looking back on it, I remember the frustration of having borderlines on the couch, regressing them to the stage of separation individuation, and they went on and on and on. It didn't do any good. When I put the borderlines in group, analytic group, where other borderlines say, "You're full of shit, I do the same crap," and they confront them, the transference is diffused. And they made the most progress without the regression. But essentially, what was going on in group analytic therapy was learning mentalization, learning how their behaviors affect their relationships, what they need, and how they alienate other people. Okay, identity and relationships, capacity for differentiation and integration. People who have a clear sense of identity don't give other people a hard time. You won't see projective identification in those cases. Capacity for healthy relationships, healthy self-esteem regulation. They don't need to devalue other people to regulate their self-esteem. Impulse control, a defensive functioning. Remember that scale. Is it at the psychotic level? Is it the healthy level? Adaptation, resiliency, and strength. Lower functioning people, when they have trauma, they may never recover. Healthy people learn from traumas. They go through a grieving process and they learn not bitterness, but they learn where to go, where not to go, and healthier coping mechanisms. And finally, the last section, self-observing capacity, psychological mindedness, capacity to construct and use internal standards and ideals. This is not traditional religion morality. It's included in here. Someone who has a very rigid morality would be on the lower functioning side. The higher functioning side reminds me what our Abraham Lincoln once said when he was asked why he didn't go to church. He said, if they teach me something better than the golden rule, I'll go to church. I love that quote from Lincoln. But it has to do with a higher level stages, like Kohlberg stages of moral development, and meaning and purpose in life. Now, this is a scale I wanted to validate. We didn't have a validation for it. If you want more about my talk, you'll find it in, I really recommend Karen Messina's book, A Psychoanalytic Study of Political Leadership in the United States and Russia. Again, when you have a chapter to write about your research, you don't have to worry about the reviewers saying like, oh, well, this shouldn't be an empirical research, you know. So I like that really the best. And the next one is the Journal for the Advancement of Scientific Analytic Empirical Research just accepted it. Now, I started this study collecting the data in September of 2022. Why did it take 2 years? 2 years to get, it took me about 2 weeks to collect the data, another week to analyze it. I have the statistical tools for analyzing the data. I write things up quick. Richard, how you doing? Good to see you. If you're not going to attend Richard's talk, you're really missing something. He is the leading expert in malignant narcissism of political leaders, and I've read his stuff. It's really wonderful stuff. But anyway, you could read this stuff. Oh, a little side: journals did not want to touch this research. It was rejected from 12 studies. One of my friends and colleagues saw on the listserv that I was collecting data, and he says, I'm on the board of this journal. I won't mention the journal. I want this study. And I really wanted to get it in another journal. And then it was rejected, and he was really upset. And he back channeled me and he said, Bob, our editors and the board didn't want to touch this because the Trump organization, we don't want to go through what Bandy Lee went through it at Yale. So, well, it turned out 12 other journals all over the world rejected this. I've never had all of you who publish know what it's like, okay? But eventually you find something. I finally found a journal, a good journal, agreed to publish it. But it was dangerous. A lot of people saw it as dangerous. A lot of the jurors in New York City, one left because she was afraid of the intimidation. Okay, so this is my point. It's possible to evaluate. Let me see if I can move this. No. It's possible to evaluate candidates based on their documented statements and behaviors, similar to how I work as a forensic psychologist when I go to court. The court, there are rules of evidence, federal rules of evidence, that my testimony must be based on empirical science. The American Psychological Association, unlike the American Psychiatric Association, which has a crazy thing from 1970, it's archaic, called the Goldwater Rule, based on the fact that Goldwater sued a magazine and some psychiatrists for saying that he was a flake. But that was before telehealth. It's an archaic rule, and they use that to go after Bandy Lee. Very few psychiatrists follow it, but psychologists follow something close to the federal rules of evidence. In other words, as it should be, that our diagnostic work must be based on science. We don't listen to the heartbeat. We don't take a physiological measure to come up with a diagnosis. We're not looking for a brain tumor. If we're looking for a brain tumor, the science would say, okay, Do we have an EEG? Do we have a functional MRI? Do we have scientific basis? But we're assessing personality traits. Do we have sufficient scientific data, measurements that we could testify, that we could publish in this area? That's the standard for psychologists. It's not the Goldwater rule. I recently published an article that psychologists are not gagged by a Goldwater rule. An independent group of expert psychologists applying a strict validated methodology can use their assessment of political candidates to help educate the public and compete with political propaganda. We have, we have to compete with political propaganda. We have intellectual magazines, excellent journals that the people who vote for the populist authoritarians never read. In other words, we're not reaching the people who need to get this information. The National Rifle Association grades our politicians on a scale in terms of how much they vote against any form of gun control. What we really need is something that will get published that grades candidates according to their mental functioning, not using psychiatric labels. And let me give you an example of the cost. Hitler, Stalin, and Mao Zedong, still considered by a large portion of the people in their respective countries as deities. Now, in that little window of history, we're psychohistorians, right? That little small window of history, 1933 to 1976, after the Cultural Revolution, it's very hard to estimate because it's very hard. And I certainly be criticized for this number. There's a range, but for the sake of my argument, I didn't put in the range. It's estimated 190 million people murdered by just 3 men. That's the cost. We need to do something. Now, here's the abstract. And again, this is about testing the Psychodynamic Diagnostic Manual. We want empirical testing. It's operationalized by the Psychodiagnostic Chart that Bob Bornstein and I developed so that we can test the clinical utility. And some of you may not be familiar with that word. You all know validity and reliability. We have millions of studies that show validity and reliability on trivial subjects. Academic psychology is wonderful at publishing trivial subjects. Peter.
5 minutes.
What's that?
5 minutes.
Okay, right. Let me get to this. What we got as a result is, and what I used is a group, 50 experts. One, they have to be experts in psychodynamic theory and experts in assessment. So this is not a random sample. This is an expert sample. I wanted at least 50 so no one could say it. Statistically, just correlate what their political orientation is and how they rated people. All the ratings were non-statistically significant, which means if you ask professionals to rate people, okay, according to psychological variables, they would do a good job. And other studies show that. If you ask professionals, academics to do these ratings, you won't get statistically significant bias. Zelenskyy, in terms of percentages, in terms of mental functioning overall, the higher the better, 91%, Putin 41%, and Trump 25%. That's 25 out of 20. 20 is the lowest. Here you can see, and I'm going to go through this quick. I'm not going to be so pedantic. They're almost at 1. Very rarely in the social sciences, here you see Trump at 1 on a scale from 1 to 10 of our 50 experts at a 1. No one gets this. Putin is about a 2. Zelenskyy is at the other end of the scale. I picked these 3 people because I wanted how the scale could differentiate people close together, and the scale, if it has clinical utility, far apart. And if you look at what we picked was 70%. This is the metric people could understand. It's like your grades. If a political candidate or leader is below 70%, they're not fit for office. This is the metric we want to get out there. It is very easy to get a group of 50 experts and ask them to rate the mental functioning of candidates or leaders, and to publish and to get it out there in the press on a scale of percentage that if they're at least at 70% of mental functioning. And that's it.